In your statement, Cabinet Secretary, you state that over 1 million people receive NHS dental treatment annually, but your own government figures show that patients' numbers remain 30% lower than what they did in 2019, and many people across Wales are still struggling to access an NHS dentist, with some waiting years for an appointment. So I'd like to know, do the Welsh Government actually know how many people are actually waiting on a waiting list for a dental appointment? You have announced a digital access portal which you claim will make it easier for patients to get NHS treatment. However, all this does is register demand. It doesn't actually increase the number of available NHS appointments. So I'm just interested, Cabinet Secretary, how many patients have successfully received an NHS dentist through this system since its launch? And will you acknowledge today that unless more NHS dentists are recruited and retained, the system will only serve as a waiting list rather than a real solution to the problem? You state that this new general dental service contract will provide fairer, more transparent remuneration. But let's be clear, negotiations ended without full agreement between the government and the BDA. Since 2022, 189 NHS dentists have left the service in Wales. That represents 13% of the workforce. And the BDA have warned that in 2025, we could see the largest number of contracts being handed back in history, with more dentists reducing their NHS commitments due to financial pressures. So I'd be interested to know, how do you expect to prevent further dentist departures when the contract has not been fully agreed with the profession? And what assurances can you give to NHS dentistry across Wales that they will remain financially viable for practices under this new contract? And how will you address the pay challenges faced by trainee dentists with their issues with back pay in their salaries? Cabinet Secretary, your statement outlines that the new contract variations have helped improve access. However, practices are facing severe financial pressures, including underfunded rises in employer national insurance and living wage costs, which are imposed by your government in Westminster, and a 6% contract uplift that the BDA says, in real terms, is a pay cut due to double-digit inflation. This government has said its hands are tied, yet it secured an 11% uplift for GPs, while NHS dentists were given just 6% with added conditions. And I'd just like to know, why is the Welsh Government failing to provide a fair financial settlement for NHS dentists across Wales? And what immediate support will you offer to dental practices struggling with rising costs to prevent further contract handbacks? You say that this government is committed to improving access, but investment in NHS dentistry is actually declining. Your own figures show that last year, less was spent on NHS dentistry in 2023-24 than in previous year, despite an increase in patient demand. At the same time, patients' costs have skyrocketed. Urgent care charges have more than doubled, and many patients are now paying up to 85% of their treatment costs. I'd like to know, Cabinet Secretary, how do you justify record increases in patient charges when overall spending on NHS dentistry in Wales is actually falling? And will you commit to freezing or reviewing these charges to ensure that patients are not being priced out of essential NHS care? You say that this new contract will fundamentally reform the model to move away from outdated units of dental activity system. However, the BDA has warned that the negotiating process was flawed and lacked the financial envelope to deliver real change. They argue this contract is not fundamental reform of the profession that they were promised and patients were promised. So can you confirm whether any additional funding will be made available to support this new contract beyond the existing budget? And how will you ensure that this contract doesn't simply shift costs onto dentists and patients rather than fixing the deep-rooted financial issues in the system? Cabinet Secretary, NHS dentistry is in crisis. Patients are paying more while receiving less. Dentists are leaving in record numbers and practices are struggling to stay afloat. What they need to see is action, not warm words, and a real commitment to investment and reform. The new contract, through presented as progress, was not fully agreed upon with the profession. It lacks the funding that's needed to make it more sustainable across Wales. As I said, patient charges record high, while the government investment is falling. Practicing are buckling under increasing costs, and without urgent intervention, they're all going to hand back their contracts, pushing NHS dentistry closer to collapse. So, Cabinet Secretary, will you act now to properly fund NHS dentistry, retain the workforce, protect patients from spiralling costs, or will you just stand by, as other Cabinet Secretaries have before, and just see the system fail?
Well, the member's questions bear absolutely no relationship to reality or to the statement which I've just given today. The truth of it is, I take from the fact that he presented almost no challenge to what I said about the new contract, that he at least accepts the principles that we're trying to deliver through the reforms. He asked a number of questions, and I will do my best to answer some of them. The Dental Access Portal has been in operation for, I think, 4 weeks at this point, so the true effect of it obviously will not yet be felt, as the member wouldn't expect it to be. It does, as he says, help us understand the true level of demand for NHS dentistry in the system in Wales. It is a portal and therefore self-evidently does not itself provide access to more NHS dentistry overall. However, it is important, which I presume is why the committee recommended that we explore this, in providing a single point of access and a more convenient way for those members of the public seeking NHS dentistry to get access to them without having to ring round a number of practices, which has been the previous which has been what's required previously. So I think that is a positive step forward. We know that broadly half the population have access to NHS dentistry, and we absolutely understand that there's a greater level of demand than there is supply of the service at the moment. He makes the point about the change in the number of dentists. My figures tell me that the number of dentists providing NHS treatment has actually remained broadly static over the last 10 years. So in 2023-24, there were 1,398 dentists which recorded NHS activity, which is about 40 fewer than 10 years ago. There is clearly more demand than there is supply, but I think the position is not quite as the member described it. What we want to make sure is that doing more NHS activity is attractive to more dentists. So the purpose of the contract is to seek to improve that, both from the point of view of dentists, so that they get a fairer package of remuneration, and he will see when the consultation is published that some of the points he made about that will have been addressed in the contract, whilst also making sure that that we extend NHS dentistry to more of the public. He made some points about charges for patients, and he will, I'm sure, be pleased to know that the overall effect of the new contract will be that more people will be paying fewer for their dental treatments than would be the case under the current regime. So that is a positive. He made a point about pay. I think it's important to bear in mind that the arrangements which I unilaterally introduced at the start of this year, a few weeks ago, represented the single biggest increase in dental independent practitioner pay ever. So, he may make whatever comments he wants about that. That is, in fact, the position. And I was not prepared to delay any further providing dentists with the funding that they need. And that is why I took the decision which I took a few weeks ago.
Ignore the member's commentary from a sedentary position.
I'm pleased that we have been able to do that. Dentistry required the funding, and we were glad to have been able to make it available. It is the government's position, for which I make absolutely no apology, that where we provide significant uplifts to independent contractor contracts, we do and will and always will require in return modifications and reforms. That is a perfectly reasonable position for us to take, and it's completely consistent with wise stewardship of public funding, and I make no apologies for doing that. And by the way, I think my experience to date suggests that that broad package has been generally welcomed by the profession, and I think that is a positive thing. He makes an important point about viability of dental practice. Clearly, we need to make sure that the contract is attractive to dentists, because what we want to see is more members of the public having access to NHS dentistry, and we will only achieve that if dentists choose to take on the NHS contract. The variations we've seen so far have been taken up in very large numbers. They do not by any means solve all the challenges. And whilst it is the case that not all aspects of the contract on which I'll be consulting from next week onwards have been agreed with the BDA, large parts of it have been. I would contend the most important parts of it have been, and I've made an offer to the BDA to continue discussing with them the refinement of those elements which have not yet been agreed, but I was simply not prepared to wait any longer. It is clear that there needs to be contract reform. It is clear that dentists expect and are entitled to a lead-in time for those arrangements to be in place. And so I'm absolutely clear that we want the new contract to be in place by April of next year. So we are consulting on it. We will take the views of the profession and the public, and we will respond accordingly.